I want to ask you guys a question. What would you do if your best friend punched you in the mouth, stole your money, and poisoned your food when you weren't looking? So let's talk about chewing tobacco. It wrecks our mouth, takes our money, and slowly poisons us over time. I like to think that most of us would ditch a friend that was physically abusive and taking advantage of us. I'd like to think all of us would ditch a friend that was trying to poison us. So why do we overlook these things in tobacco when we wouldn't overlook them in a friend? Because these things are a slow process and not always immediately obvious. It's easy to overlook a couple of dollars here and there, or to ignore unseen damage being done. But that doesn't mean it isn't happening. My hope is that we can make some of these issues more obvious and keep tobacco from doing more damage to us and the people we love. What are the costs of chewing tobacco? Have you ever thought about the toll it could take on your relationships? How about dating relationships? Stained teeth and bad breath aren't exactly attractive, not to mention all of the other image-related consequences we'll talk about shortly. Or maybe it's family relationships, hiding your habit from your parents and having to face that awkward situation or fight when they find out. And how does chewing tobacco affect you professionally speaking? Do you think it will be easy to get a good job or to be taken seriously at work? Or let's say you want to go to professional school, medical school, pharmacy school, or dental school. Could you imagine what a dental school interviewer would think if they saw those stained teeth and bad breath? How can they take you seriously when you say you want to take care of other people's teeth when you won't even take care of your own? What about monetary? Have you ever sat down and calculated how much the average person might spend on chewing tobacco in a year? Most importantly, what are the implications for your health? I think we can all imagine how it could affect our image and relationships. I want to take a closer look at monetary and health. So let's look at the monetary cost of 5 of the more popular brands. These are small-town Kentucky prices, and they are surprisingly cheap compared to prices outside the state. So keep that in mind if you ever consider traveling or moving outside the state. I'm assuming half a can per day. So let's start with Copenhagen. At $3.19 a can, you're looking at $582 a year. That's an iPhone. Grizzly at $2.93 a can, $534 a year. Skoal at $3.66 a can, $668 a year. Kodiak at $4.27 a can, $779 a year, getting really expensive. And Redman, assuming half a pack a day, at $5.71 a pack. $1,042 a year. That's 2 iPhones, or whatever else you'd prefer. I'm sure you can come up with something better to spend your money on. But far more important than money is your quality of life and health. I will warn you, I'm not going to sugarcoat this, because there's nothing sweet about what tobacco can do to you, so prepare yourselves. I don't show you all of these pictures and videos just to gross you out or traumatize you. I'm doing this because I care about your health and happiness, and I want to make sure that you are fully informed of the consequences before you choose to use tobacco. It's really easy to dismiss these negative effects and think of them as something that only happens to other older people, but that's not always the case, and I will show you this a little later. So just try to be open-minded and really consider how these things could affect your life. Put yourself in the shoes of the people in these pictures and try to imagine how your life would change if this happened to you. Stained teeth. Yes, this is a dramatic picture, but I promise that if you keep chewing and don't take care of your teeth, this can happen. We've already briefly discussed the image issues that come with chewing tobacco. As much as it shouldn't, image matters in our society. Beyond personal relationships and dating, things such as bad breath, tooth stains, and tooth decay and loss can contribute to poor first impressions in important areas of life. A bad first impression can really have major negative impacts on your job and professional school interviews and the ability to be taken seriously in a higher level career. So consider what you want to do with your life. How would this affect those plans? Black hairy tongue is another visible consequence of tobacco use. It's a buildup of dead cells and other debris like food that lead to bacteria and fungal infections. While it's technically a harmless condition, it still looks like hair, and much like hair, requires regular shaving to keep it in check. The only way to be permanently rid of it is to have it lasered off, and since so much of your money will be spent on chewing tobacco, you probably won't be able to afford laser treatment, so get used to shaving your hairy tongue. I'd venture to guess that most people in here have had a canker sore in their life. They can be quite large and painful, making it difficult to chew, swallow, brush your teeth, depending on their location. While having one every once in a while is pretty normal, these occur far more regularly in chewing tobacco users. The gums protect the roots of your teeth, and when they recede or slide away from the teeth, as seen here, they leave the teeth movable and the very sensitive roots exposed to food and bacteria. Not only is it very painful to have the root exposed, but it facilitates tooth decay and loss, as seen in the left picture. The only way to really prevent this decay is by grafts to cover up the exposed root. This involves cutting pieces of gum from inside your cheeks and sewing it over the roots, as seen in the picture on the right. Pay close attention to the redness around the graft. This is a painful procedure. And unfortunately, there is always a chance that your body won't accept the graft and the tissue will die, and then you'll be back at square one with a receding gum and exposed root, susceptible to tooth decay and loss. Speaking of tooth decay and loss, I'm sure most people in the room have had a cavity or two in their life, and most likely that has been fixed with a simple filling. Sometimes, however, the cavities can progress beyond the ability to fix them with a simple filling. The decay can take over most of the tooth, and even weaken it so that pieces break off, leading to the need for a crown. This process involves filing down what tooth you have left and gluing on a ceramic tooth made to look like your own. This is a long process requiring multiple visits to the dentist, and afterward you are limited in some respects to what you can and can't eat, because some foods can pull the crown off, and then the process has to be repeated. Beyond the frustration of having this done, think about the cost that piles up with all of those visits and procedures. Now let's say the decay damage leaves the tooth in such shape that there isn't even enough left to do a crown. Then removing the tooth becomes your only option if it hasn't already fallen out on its own. And in all of these situations, there's likely constant pain, and that can lead to a root canal. The dentist drills into your tooth and cleans out everything in the root so you can't feel anything in that tooth anymore. While this sounds like an easy fix, this is typically viewed as the most painful procedure that the dentist does, and many times people opt to just have the tooth pulled instead. With all of these different procedures, as well as with the natural decay process directly caused by the tobacco, there is always the risk of an abscess or infection. Infection can lead to weight loss due to the inability to chew through the pain. I have personally seen abscesses lead to the breakdown of the facial and jaw bones, and the infection can even spread outside the mouth into your brain or into your blood, causing something called sepsis, which can be life-threatening. A simple infection can kill you. All of this thanks to the damage chewing tobacco can do to you. Now we progress to even more serious consequences, as if the possibility of a deadly infection weren't serious enough. I'm sure you've had a dentist get onto you for not flossing. This is to avoid the problem of gingivitis shown on the left. Tobacco makes you highly susceptible to gingivitis, and continuing to chew while it's present makes it very hard to overcome, leading to periodontitis shown on the right. Periodontitis leads to gum and bone destruction, much the same as gingival recession and abscesses. On top of this, it has also been linked time and time again to increased risk of general heart disease, heart attacks, and strokes. Heart disease is the #1 killer in this country, so even though gingivitis seems common and run-of-the-mill, you shouldn't overlook it. This is leukoplakia, an abnormal growth anywhere inside the mouth, on the gums, in the cheeks, on or under the tongue. Sure, it's gross looking, and that plays into the image issues we've discussed. But more importantly, once you see this, you are one step away from cancer. And maybe it looks like something you can just scrape off, like the hairy tongue. But this is actually your own cells changing in response to the chewing tobacco. Since it's actually a part of you, it requires surgical removal, and now you're looking at removing parts of your mouth, your cheek, your tongue. But the great thing is that if you quit chewing, your body can fix it and it will go away on its own. This is obviously a much better option than surgery, because surgery always comes with unnecessary risks like bad reactions to anesthesia or major blood loss. You should avoid it if at all possible. Let your body take care of itself.
When you see yourself like that, it's hard to believe that it all began with a can of dip. But then you start to look back. When your teeth started getting loose, when you ignored the signs, when you thought white patches were no big deal, when you believed a can of dip could do no harm. Dip can cause mouth cancer. Smokeless doesn't mean harmless.
So the FDA is working to address chewing tobacco as well with ads like this, showing the progression of damage and the repercussions of ignoring those early signs of damage. We've just discussed all of those early signs, but by the time you start seeing them, you've already done a considerable amount of damage to yourself. With every dip, every canker sore, every patch of leukoplaskia, your risk of cancer goes up. One of the reasons the FDA is running this campaign is to address a widespread misconception that chewing tobacco is a safe tobacco alternative for smoking. Unfortunately, this belief is particularly common in teenagers and young adults hoping to quit smoking and avoid lung cancer and all the other problems that come with smoking. The problem is there is no safe tobacco. Chewing tobacco comes with its own set of problems, like higher rates of oral cancer. Here's a quote from the Oral Cancer Foundation. While historically the majority of people are over the age of 40 at the time of discovery, it is now occurring more frequently in those under this age. There are links to young men and women who use conventional smokeless chewing or spit tobacco. Promoted by some as a safer alternative to smoking, it has in actuality not proven to be any safer to those who use it when referring to oral cancers. Campaigns to promote the safety of smokeless are being initiated, but it is clear that while it may reduce lung cancers, it has a negative effect on the rates of oral cancers, pancreatic cancer, periodontal disease, and the chronic infections that it produces may even link it to heart disease as well. The gains against lung cancers may occur, but there will be new losses in other areas. So not only are we seeing an increase in different types of cancer, but they are occurring at younger ages thanks largely to chewing tobacco. Chewing tobacco contains 4,000 total chemicals. 4,000! And over 30 of them are known to cause cancer. Not just suspected, but known. I've put together a list of some of the more widely recognized ones, starting with nicotine. Everyone talks about how addictive nicotine is, which it is, but I bet no one ever told you that it can cause cancer. And on top of that, if you get too much of it in your system, you can get nicotine poisoning. Chewing tobacco actually has a greater risk of this than cigarette users. 1 can of dip is equal to 4 packs of cigarettes in nicotine content. In its mildest form, nicotine poisoning causes depression, stomach upset,